Hey y'all, and welcome to my channel, or welcome back. On this page, I talk about technology and money and sometimes trending news. Happy New Year to everyone. Hope your January 2024, your 2024 is off to a good start. Okay, and yeah, I came across this interesting news story that just caught my eye, and wanted to share it with you guys. Maybe folks have seen it. Now, the story originally came out in May of last year, so May of 2023. But Becker's, so I've talked about Becker's before. Becker's did an update on that story. And did a release. I think, well, it came, I picked up on it today. The update may have came like the day before or something like that. But it's around this health system that has given or is given all of their nurses the option of signing on for a $100,000 retention bonus. And yes, that $100,000 nurse retention bonus is real. So that caught my attention for sure, for several reasons. One, for those who've been around here for a while, for those who may be new here, I am a registered nurse. I work in tech now. I've worked in tech for quite some time. Even before I worked in tech, now there's a nurses shortage, right? Because they've talked about what happened over the past few years with since 2019. That definitely made the nursing shortage worse. But I can say, ever since, even when I was in nursing school, when I was a new nurse many years ago, there was a nursing shortage then. I have never not known there to be a nursing shortage. I've heard my entire nursing career, and I've been a nurse for over 20 years. I've always heard that there is a nursing shortage, and there's always been hospitals in need of nursing. It's a very much in demand profession. If you practice, if you have a valid nursing license and provide good care to patients, you're fully competent, you're compassionate, etc., there is no shortage of opportunities available for nursing. Now, to say that, also there are environments where I've talked about on this channel before the type of pressures and expectations that are put on nurses at the bedside. Oh, let me clarify. I'm talking about nursing at the bedside, right? So not nurses in specialties like say like a nurse practitioner or a nurse anesthetist. I'm talking about nurses at the bedside. So when I say nurses at the bedside for non-healthcare people, I'm talking about when you think about your traditional type nursing, that's what I mean by nurses at the bedside. So I'm going to share my screen, and this story intrigued me so much because hospitals over the past few years, especially since 2020, even before that, have had to be creative and remain creative to retain their nursing staff. I've talked about what North Carolina is doing or has done. There's some data that I think it was the board of nursing helped come together. They got with some researchers and some data analytics to help the state of North Carolina hospitals and health systems prepare and plan for how much worse the nursing shortage is going to be in a couple of years unless certain things change. But hospitals in North Carolina, South Carolina, Virginia, Tennessee are not the only ones who've had to get creative. Okay. Let's see if I just share my entire screen. If it'll let me, will it let me? Yes, it will. Okay, y'all just bear with me because I just only have one screen today. So, matter of fact, let's do this. Instead of sharing my entire screen, let's just share one tab at a time so it doesn't look so discombobulated. Thank you for your patience. But yeah, when I saw this $100,000 bonus, I going to share the news story first, and then I'll share the backstory. Okay, so this is a health system in California. So a health system is typically more than one hospital. So a health system can be 2, 3, 4, 10, 20 hospitals within a group. So this health system, Palomar Health in Escondido, California, gave $100,000 bonuses to their nurses for retention, because hospital and health systems and beyond them, but beyond like just hospitals and health systems, but healthcare providers have had to continuously find creative ways to keep their nursing staff, especially since 2020, when when travel nursing was at an all-time high. Travel nursing has always been in demand. Please be clear about that. But at the height of what occurred in 2020, 21, 2022, y'all know what I'm referring to. Those travel nursing contracts were running 200,000, 300,000. I mean, and above. Like that's how in demand travel nurses were, and that's how in demand the nursing workforce and labor was needed, how much hospitals were willing to pay. But do you think about paying a travel nurse $300,000? That's how much the nurse is getting paid. So if the nurse is getting paid $300,000 a year for traveling, you can imagine what the hospital is paying out, because the nurse gets a cut, and then also the travel nurse company that the travel nurse works for also gets a cut, right? So you can see how quickly, if hospitals are paying $200,000, $300,000 and more up per travel nurse, how quickly that can eat into costs. So what this California health system decided to do is that, hey, instead of paying these travel nurses these big contracts, why don't we give money to our permanent staff to retain them, so we're not paying out for this contract labor? So this health system said they realized they had a nurse retention problem as the system emerged from the pandemic. Like many health systems, the Palomar relied on travel nurses to fill the gaps and the strain from nursing workforce shortages. They knew that the rate in which they were utilizing travel nurses, so they say contract labor in this article, but contract labor is travel nurses, it was unsustainable. So they decided to do something drastic. So they did not want to just bring in a travel nurse for like 1 year and pay them $200,000, $300,000. But they wanted to just retain that staff, right? So their president and CEO, I wonder if their president and CEO is a nurse. Let me see. I'm just curious. I wonder if she's a business person. That just dawned on me, because I was like, let's see, what is she? Y'all just bear with me. She's actually a CPA. Now that's interesting. Because usually, and I say that's interesting because I have seen hospital presidents be nurses. I've seen hospital presidents who are physicians, or people who have like business degrees, like MBAs or masters of health administration. But this health system president and CEO is actually an accountant. Now that's interesting. I just thought to look that up real on the fly. But anyway, so their hospital president was like, hey. And you know what? Probably was her. Now I'm thinking, with her being an accountant and running those numbers short term and long term, she said, okay, instead of us paying these travel nurses, what we're paying them, why don't we give that to our permanent staff? So that's what they did. They knew if they did not do that, I'm assuming based on how the article is written, they ran the numbers of like, if we don't stop paying as much as we're paying for travel nurses and not do something for our permanent staff that we actually want to keep, that we know will be here more than just 1 year, who will be here for the long haul, it will be a better payoff for us in the long haul. So she said, we knew we had to find the sweet spot to find the right dollar amount that would entice nurses in and the right amount of time to tie them to the organization. So when it says tie them to the organization, that says to me, like, not only keep them, retain them, but keep the loyalty, right? I've heard in the past about the nurses shortage. I've heard folks say it's cheaper to keep her, not in terms of a marriage, but in terms of keeping a nurse or even staff, right? So the hospital team decided on $100,000 bonuses over 3 years, because if the nurses stayed for 3 years, there was a higher probability that that they would stay longer. The hospital has several clinical and non-clinical staff members who have been there for 20 years, and they knew, they said they were successful at creating a culture that made people feel at home, etc. And she said, she being their CEO, said they didn't even need 3 years to see the impact of the bonuses. So they put this into place last May. They said it was incredible in reducing their reliance on travelers and agency staff. And again, that's contract labor or travel nurses. They've been able to fully staff their emergency department fully with very little contract labor. Let me tell y'all something. For those who are not in healthcare or not a nurse, well, all nursing positions are needed and important, but emergency department nurses, those are the nurses that have to be able to take care of anything and everything. So you have like your specialty nursing, like oncology. I was an oncology nurse before I moved into tech. You have your surgery nurses, you have your medicine nurses, you have your geriatric nurses, so the nurses who cares for the elderly population. You have your pediatric nurses. That is very much a special, those are very much specialty types of nurses. But the nurses who work in the emergency department have to be smart and nimble-minded enough to be able to take care of any type of patient that walks through the door, no matter what the patient is coming in for. They have to be able to, provide a level of care. So for this hospital to be able to staff their emergency department in full with hardly no travel nurses, y'all, that is very much significant. That is not a little thing, okay? But anyway, so the health system made the bonuses available to new and existing nurses, and that they had several months, they had a couple of months to think about, okay, do I want to sign up for 3 more years of working at this health system for $100,000? So they did give them some time to think about it. And not only did they offer the bonuses to new nurses, people who like, okay, I heard about this $100,000 bonus, I want it, but they also offered this incentive to their current nurses. Y'all, when I tell y'all that this story is knocking me off of my feet, okay, I have never seen such a significant investment in nursing, labor, and retention. I have never seen this. This is why this story is really knocking me off of my feet, because you think about it. I'm gonna wrap up here in a few minutes about the impact, because if you think about a health system offering nurses $100,000 retention bonus, how big of a financial impact that can have to that nurse and their family. That is such a significant impact. Let me just take a quick moment to say hello to the chat. Hello, chat, and everyone listening. Char Willie is here. Conversations with Char Willie. Hey, Char Willie, greetings. Happy New Year to you. You all, please go check out her channel as well, and please support the work that she's doing on her channel. But back to the story. Let's finish up this article, and I'm going to share a video from the health system's president, because again, she is a CPA, and I think I'm thinking, this is me assuming, not knowing. Again, I have seen health system presidents who are usually like biz people with MBAs, health administration masters, nurses, doctors, but I really, in my gut, something is telling me with her being a CPA and having the wherewithal to run the numbers, because she's the one who ultimately made this decision, is the reason why this decision got made. Okay, so they built, not only did they are they giving their nurses $100,000 bonuses, they're also investing in these nurses in non-financial ways, because I've seen people talk about, it's not always about the money, right? Of course, people want to get paid, be paid fairly in good salaries, but also what is the culture like? What else am I getting in terms of like education? So they also implemented a program with one-on-one personal wellness coaching with a focus on physical activity, better sleep, nutrition, mental wellness. Y'all, that is so big, just because the emotional labor of nurses who work the bedside in a hospital is so heavy. If you're not a nurse, I can just tell you as a nurse, the mental emotional workload on you as a nurse. It's very heavy, no matter where you practice. And then you think about you have to go home and do the emotional labor of caring for your family. So to have this program where you're getting this wellness coaching, nutrition coaching, sleep coaching, mental wellness, this is huge. So they implemented it for the leadership team, and they're also giving it to the nurses. The CEO says we're in the business of healthcare, but one of our overriding roles is to teach people how to be healthier and stay out of the hospital. So, and then she talks about the investment in health and wellness, and finish out the article by saying if you can get energized, happy, and connected team members taking care of themselves, that translates into a better patient experience and overall benefit of the organization. Y'all, this is knocking my socks off. So when I saw this article about the $100,000 bonuses, I was like, of course I had to do some. I was like, let me just make sure this is. Let me go back to the original when they first announced the bonus last year. So I found the video. Here, let me share my screen. Excuse me, I found the article in the video when they first announced the bonus last year. Again, because the news, it got announced and offered to the nurses from March of August and to August of last year. They gave the nurses a little bit of time to decide if they wanted to sign up. Because you get the $100,000, but you have to also agree to stay with the organization for 3 years. So I think that's really good that they gave folks some time to consider that, because that's not a little thing to commit to staying at an organization for 3 years, especially in this day and age, where, people, they're, the people may go to a job, stay a year or two, and then they go to another job for higher pay, better benefits, or because it's better for their family. So, but to make a 3-year commitment, that's not a little thing. Okay. So I found the original video here where they're talking about it, and I'm going to see if I can share. Let's see. I'm going to start it, and I'll play just a little bit. And if those in the chat can tell me if you can hear the audio, I'd appreciate it. I'll just play a couple of.
Yeah. Awesome. It's career fair day at Palomar Health's SK.
Can y'all hear that? Is the audio okay for y'all on that? If anyone can just confirm in the chat that you can hear that you heard that audio okay. Loud and clear. Wonderful. Thank you, Char Willie, for confirming that. Okay, so let's go back. I'm going to start it over from the very beginning. And the video is less than 3 minutes. Okay, so here we go.
Yeah. Awesome. It's career fair day at Palomar Health's Escondido Hospital. The health system is looking to hire up to 250 nurses, and many applicants were getting on-the-spot offers Wednesday.
Congratulations, you obviously made a great impression.
Health systems across San Diego have been upping their game to attract nurses. Palomar Health recently introduced a 3-year, $100,000 sign-on bonus. It's for new and existing full-time nurses, and it's something many at the career fair were aware of.
You know about this sign-on bonus here? We know that you have multiple positions open.
Pamela Travis is an intensive care unit nurse in Temecula. She says the bonus is one of the reasons she's interested in working for Palomar.
I definitely think it was the initial attention grabber. And then I think though you always have to show up to a facility. You have to see how the floors are run. You have to talk to your managers.
Hospital leadership introduced the $100,000 sign-on bonus for full-time nurses in April. It requires a 3-year commitment and payouts would increase over time. The bonus is for new full-time hires as well as existing nurses.
Many of them thought it was too good to be true, but we wanted them to know that there's no catch, there's no gotcha. We are very serious about this program.
And I'm pausing it real briefly, y'all. That's the CEO and president of the hospital that I was mentioning. She's a CPA
program and
or an accountant for those who don't know what a CPA is. Yes, she's an accountant. Sorry.
Really want them to know how much we want them to stay.
Palomar Health CEO Diane Hansen says there's a bonus for part-time nurses too, but those are lower and they depend on hours worked. She says it was introduced to move away from contract nurses, which have been expensive.
We're spending anywhere from 50 to 60 million this year in contract labor. And so we wanted to take those dollars, if we can save, some of that money and put it towards this bonus program, that's what we're trying to do.
Palomar Health has around 1,800 nurses, not all of them full-time. To get a sense of how much this could cost the hospital, if 1,000 nurses got the full bonus, that would be $100 million over 3 years. Chief Nursing Officer Melvin Russell says most existing employees have signed up for the bonus. He says it's also helped attract a lot of new applicants.
Post-COVID, we really were, as all healthcare agencies, were really struggling on applicants.
The American Hospital Association reports an older workforce, a surge in retirements, and pandemic burnout is driving a nationwide health worker shortage.
As simple as that. Yeah.
Palomar health officials say the hardest to recruit are in labor and delivery and operating room nurses.
Now, I found that really interesting when I watched this video for the first time, that the greatest demand for the specialty of nursing for this hospital, which is in like near San Diego. I Googled it. It's in North San Diego. But that they are in most need of labor and delivery nurses. So that's the nursing specialty that helps women through their delivery of their child. So labor, when a woman goes into labor, and those are also the type of nurses that help care for the women once they have their baby and they're still in the hospital. So I found it interesting that this health system is most need of labor and delivery nurses, considering what's happening in different states and nationwide around women's rights and reproductive health. Okay, just a few more seconds left.
Matt Hoffman, KPBS News.
Yeah. So this article, be sure to, as always, once the live is over, leave a link to this article, as well as the previous article in this video. But I just found this so interesting, considering how much in demand nurses is, and how much work a lot of health systems and hospitals have put in trying to retain their staff, how much has been put on the profession of nursing, especially what happened with the pandemic and things like that. And also just, again, the emotional, there's a lot happening in nursing right now, right? There's workplace violence is at an all-time high. Workplace violence means there's very high instances of patients and family members attacking nurses. Of course, there's staff shortages, which we talked about, and there's other things, right? There's like nurse bullying, that's the thing. There's lateral violence and things like that. But this $100,000 bonus, y'all, it just caught my attention, because if you think about, and there's another creator here on YouTube. Her name is Mocha Mommy, and she's also actually a registered nurse. She's based down in Texas. But Mocha Mommy has talked about nursing and just the various incentives that's available for people thinking about going into nursing, and how, because there's already hospitals out there paying for nurses to go to college and paying for their degrees and giving like $25,000 bonuses and things like that. And even if you have an associate's degree versus a bachelor's degree. So she's talked a lot about the future, the current and the future of nursing workforce. So I think about what she talked about in a video she did last year around just incentives. And if a person who is interested and compassionate and has the empathy to go into healthcare, how much incentive that is, and how financially it could change that person's life, but also their family and their community, this $100,000 could do so much. Now, this is North San Diego. I don't know what the cost of living is like in San Diego, right? I don't know if, how far, like if it's an expensive city like New York or Miami. I know Miami is very expensive, and some of those big cities, but still $100,000 is not a small piece of change. All right, that's all I wanted to share with you all. Again, I'll be sure to leave a link. Thank you to the folks who did tune in to the live. If you made it this far, please do like the video. I appreciate it if you do. It does two things. It helps the algorithm. So if you're interested in this video, other folks may be interested as well. And then number two, it encourages me to continue creating content that you all find interesting and engaging. Okay, Happy New Year again to everyone, and I'll see you in the next video.